good morning. My name is Marissa. I'm going to be the nurse practitioner today.
Hi.
What's your name?
Hi, I'm Mel.
Nice to meet you, Mel. What's bringing you in today?
Well, I just feel like the room is spinning.
Okay.
I recently went on a hiking trip in Colorado.
Okay.
And on the drive back, I just noticed that the room was spinning. I was pretty dizzy.
Mm-hmm.
We got back, and I still felt that way. But then yesterday, everything just got worse. The room, I felt more dizzy, and there was a pain in my ear. And now I feel like in my left ear, I cannot hear that well.
Okay. So you still feeling pretty dizzy right now?
I am, like, even trying to focus on you, I feel like you're just kind of like spinning with me.
Okay, so everything in the room seems like it's spinning right now?
Yes.
Okay. So you just got back from a trip. You drove in the car. Do you
Yes.
normally get car sick or seasick when you're in the boat?
I've thrown up a few times.
Oh, you have? Okay.
While on a few road trips, also sometimes on the plane at times, a little motion sickness, I would say.
Okay, so you usually are motion sickness anytime you're in any type of vehicle that moves.
Right.
Okay. Well, I'm just going to take a little bit of notes while we're speaking together.
Sure.
So, do you smoke cigarettes or drink alcohol at all?
Wine occasionally, but not every day.
Okay, and cigarettes at all?
No, I do not smoke.
Okay, perfect. And we took your vital signs earlier. It looks like your heart rate was a little bit elevated.
Yeah.
Having a little bit of increased work of breathing, which seems like when you're feeling dizzy, you're do you feel like you're having any sort of chest pain or any sort of...
No chest pain.
No.
Just kind of slightly anxious about what this possibly could be, But
Okay, feeling a little bit anxious.
Yeah.
Absolutely. Okay. And looks like your blood pressure was just a little bit low. Does when this started, first of all, when did this start?
Well, we came back. Let's see. We came back 2 nights ago, so Saturday. So I want to say yesterday.
Okay.
Yesterday is when everything intensified.
Okay, so it's been pretty quick.
Yeah.
Okay. And you're saying that the pain is radiating to what side of your ear?
It's just this left ear.
Okay.
I just can't hear very well.
Okay. And is it intermittent? Does it happen constantly? Do you feel dizzy constantly, or does it happen every once in a while during the day?
Well, since the pain came on, and then since then it's been constant since yesterday morning.
Okay, so pretty constant. So you said that the room was spinning, and then as far as your ear pain, how would you characterize that pain? Is it
It's just sharp.
sharp?
Yeah, it's a very sharp pain. Yeah, just kind of stabbing a little bit, but just real sharp in that ear.
Okay, and it's only on the left side, not on the right?
Yes, thankfully.
Okay, wonderful. And then does anything make it better? Lying down or standing still, or anything make it worse, like rapid movements, getting up really quickly?
Well, I tried lying down, but just in the morning time when I wake up, if I have to slowly, I noticed well, yesterday I took a nap, and then when I woke up, I guess I must have sat up, and it was horrible.
Okay.
And then, so same thing with this morning, I had to slowly get up, because if I just kind of sit up too quickly or turn from side to side, things get worse.
Okay, so rapid movements make it worse.
Yes, you could say so.
Okay. And then you were talking about the pain is pretty severe in your left ear, and
Yes.
as far as the spinning is pretty severe as well.
Yes.
Okay, and you said that there's nothing, you're not feeling any palpitations in your chest, not feeling like you're using extra muscles to have to breathe?
No.
Not necessarily? Okay. Well, I'm going to go ahead and do a couple of small tests just to kind of narrow down what this possibly could be. I'm going to go ahead and do a quick little exam and see if we can narrow down the potential options for your vertigo. So I'm going to start with the cranial nerves and test each and every one of them to
Sure.
see if we can find any abnormalities. So I'm going to start with, let's see, your olfactory. So if you can go ahead and just tell me what you smell and
Sure.
see if you can smell it in both nostrils.
That smells like peppermint.
Peppermint? Okay,
Mhm.
wonderful. The next one is your optic nerve. We're going to check your pupils. So I'm going to
Sure.
shine a little bright light in your eyes. Okay, pupils are equal, round, and reactive to light, 2 millimeter pupils. And go ahead and look at the tip of my pen here. normal accommodation and convergence. The next is going to be your oculomotor, trochlear, and abducens. I'm going to check your extraocular movements.
Sure.
And so again, just look at the tip of my pen with
Sure.
just moving your eyes. Okay, no nystagmus is noted. The next is your trigeminal nerve. I'm going to go ahead and have you clench your jaw. Any tightness?
No, ma'am.
No? Okay, wonderful. And then move your jaw side to side. Perfect. All right, the next one is your facial nerve. Go ahead and smile big and frown. Okay, squint your eyes really big and then raise your eyebrows. Perfect. Facial nerve is intact. And your acoustic nerve is next. So I'm going to do the whisper test. And then with this, since you're having some pain in your left ear, we're going to check that out as well.
Sure.
So we're going to do the Weber and Rin test instead
Sure.
of the whisper test.
Sure.
And I'm going to go ahead and start with the Weber test. I'm going to hit this tuning fork and place it at the top of your head. And you let me know if you can feel the vibration on the left side, the right side, or both.
Sure.
Okay?
I felt vibrations here.
So only on the right side?
Yeah. Yeah, I only felt it here.
Okay. Well, let's go ahead and do the Rin test and see if we can determine whether it's a conductive hearing loss or with the air movement.
Sure.
Or sensory hearing loss. So
Sure.
again, I'm going to hit the tuning fork and I'm going to place it on your mastoid bone behind your ear and then move it forward and see if you can hear it
Sure.
or feel it. So we'll start with your mastoid bone. Do you feel that?
Yeah.
Okay. Now let me know when you can't hear the vibration. Can you hear the vibration at all?
I can't hear a thing.
You can't hear a thing. Okay, great. All right, so next we're going to just go ahead with your glossopharyngeal. I'm going to go ahead and palpate your throat. Go ahead and swallow for me. Perfect. Trachea is midline, normal swallow. And I'm going to grab some gloves here and check your gag reflex.
Sure.
And that also includes your vagus nerve. Okay, so open up your mouth wide and say ah.
Ah.
Okay. This might not be very comfortable.
Ah.
Okay, perfect. Gag reflex is intact. I'm sorry about that. That's never fun. Okay, and then the spinal accessory muscle is next. So I'm going to go ahead and have you push up against my hands, shrug your
Sure.
shoulders. Okay, and then the sternocleidomastoid, push against my hand with your face. Perfect. All right, wonderful. And then the hypoglossal nerve is the last one, so go ahead and stick your tongue out and twist it from left to right. Perfect. All right. Well, the only thing that I found was abnormal was obviously your hearing on the left side.
Right.
You had a positive sign to the Rin test, so we're going to go ahead and just talk about some family history really quick just to see if we can narrow down some more diagnoses
Sure.
that could be possible. So tell me about any family history that you have.
Well, my mom, she just has hypertension.
Okay.
She has that, and she takes something for her hand. She says they don't move as well.
Okay.
And my dad, he's pretty good.
Mhm.
I'm starting to think, because my grandmother had really bad vertigo.
Really? Okay.
Yeah, really, really bad vertigo. For a while, actually, I remember when I was growing up, that was an issue.
Mhm.
And then my grandfather, he unfortunately died of a heart attack.
Okay. And then any past medical history for yourself?
No, no, I don't take anything at the moment. I haven't been to the doctor in a while, to be quite honest with you.
Anything when you were a kid? Any issues when you were a kid?
I know we went to the doctor's office often. I used to have just ear pain.
Okay.
And at one point, well, I mean, I got tubes in my ears, but I mean, that was over 40 years ago.
Okay, so that's your surgical history is only ear tubes?
Yeah.
Okay, so you said you had multiple
Well, yeah.
ear tubes.
Yeah, we went quite often.
Okay, great. And are you taking any medications at the moment?
No, not at the moment.
Okay, and any allergies to medications that you know
No, no ma'am.
of? Okay, great. Have you had any fever recently or feel fatigued other than the vertigo?
No, no, just really random how it just kind of came up, but no fatigue
Okay.
or anything.
Well, I'm kind of thinking of 3 different things that could possibly be it. My most concerning would potentially be a cholesteatoma, since you've had a lot of surgeries in your ear, so maybe having some scarring inside of your ear canal and having a buildup of fluid. I'm not necessarily thinking that as much because of the vertigo. So that kind of led me to thinking of the benign proximal positional vertigo because of your sudden onset. But you did not have a nystagmus, so that kind of led me to my top diagnosis of Meniere's disease. Since you had the severe vertigo, you have the tinnitus or the intense pain in your ear, usually just on the one side, and then you're having the progressive hearing loss. So that's kind of where I'm thinking, and based on your age, being a 30-year-old female, thinking that that could potentially be the diagnosis, and with it, the family history of vertigo. So that's where I am. Thank you so much.
Thank you.